Brought to you by CGTN Europe.
Hello and welcome to this week's Razor podcast. I'm Emma Keeling.
And I'm Shini Somara. This week on the podcast, we take a look at the connection between Covid-19 and hair loss.
But I was also waking up and having hair all over my pillows, and it was generally quite annoying. Every time I would go anywhere, I'd just have hair all over me.
I don't know about you, Shini, but the pandemic is taking a real toll on many of us. But I do know a lot more people are taking a greater interest in science. So look, at least that's one good thing, right?
Now, we've covered COVID-19 from a variety of different angles on this show, but it seems that every week we learn something brand new about this deadly virus.
That's true. And one of those things is that a certain percentage of patients who contract COVID-19 are suffering from hair loss. One of those people is Roisin O'Connell. She's an administrator at a hair clinic in London, and I spoke to her about her experience with hair loss.
So Roisin, tell us when you noticed you were losing hair. Just sort of describe to us what happened.
So I noticed it around the sort of end of June. I basically noticed it when I started brushing my hair. I noticed more hair in my hairbrush, and then when I was showering I noticed it at the bottom of the shower, and it seemed like it was falling at quite an alarming rate. So obviously it was quite a scary experience. I do have generally quite thick hair, but I would say my hair has kind of my ponytail has pretty much halved in size since the hair fall that I've experienced. And I've been, so basically it would happen, obviously I'd brush my hair twice a day, would see clumps, and I'd be having to constantly pull the hair out of my hairbrush and put it in the bin. But I was also waking up and having hair all over my pillows, and it was generally quite annoying. Every time I would go anywhere, I'd just have hair all over me. I have to constantly be picking it off. Some days were worse than others, but generally quite large clumps of hair at a time were coming out.
So what was your diagnosis when you spoke to the experts? What did they say?
So when I spoke to Rali, she suspected that I had telogen effluvium. So she'd seen similar patients who'd also exhibited COVID symptoms, so she was seeing sort of an increase in that, and so it made me feel more reassured knowing that other people are going through the same thing that I am.
Well, I have an important point to make here because more research is needed to find out if COVID-19 is the actual cause of this hair loss. But look, let me tell you what is being noticed at the Belgravia Centre in London, where they treat hair loss. So you heard Roisin there talking about telogen effluvium, and it's also known as TE. It's a form of temporary hair loss, and it can occur after a stressful or traumatic event, a fever or severe illness. And it's common for TE-related hair loss to present around about 3 months after a period of trauma. So stress affects the hair cycle, and the body shuts down systems it doesn't need to focus on the biggest problem at hand. And I guess one of those, well, in terms of what the body thinks is important, hair loss is not one of those important things. And so experts at the centre have noticed that a number of their patients who've contracted the virus have arrived at their door around 3 months later.
Gosh, I mean, to be honest, Emma, the whole thing sounds quite stressful and upsetting.
Yeah, well, just imagine it. There you are suffering all these different symptoms, and then your hair starts falling out as well. So look, to look at it a little bit further, I spoke to the Belgravia Institute's superintendent trichologist, Rali Bozhinova. And in case you didn't know, trichology is the study of human hair. And she told me about when she started to notice the connection between hair loss and COVID-19.
So we started recording our data from the end of June for 6 weeks, just so we can see if our suspicions were right, if we are indeed seeing more cases of telogen effluvium related to COVID. And from 51 patients who self-reported having COVID symptoms in March or April, 30 of them also got diagnosed with telogen effluvium 3 months later. So that is likely to be related to their illness. But like I said, it could be a mixture of the fact that the illness is causing a lot of mental stress as well, on top of the physical stress.
So is the loss of hair related to stress, or is it an actual symptom that we should be looking out for to see whether we have COVID-19?
We don't really have any concrete research on this. So far the reports of hair loss have all been anecdotal. So more studies are needed for sure. But experts say it's difficult to isolate a single cause for this telogen effluvium. Because as well as stress and illness, other potential causes can include medication and dietary deficiencies as well.
So how common is this?
Well, we don't really know. I mean, obviously it was happening enough to the patients at the Belgravia centres that they sent out a press release, but scientists just aren't sure if it's significant. So there hasn't really been, this hasn't been added to the official symptom list yet. We just need that research.
So is that how you found out about this story then?
Yeah, I saw the press release, but also I'd seen Alyssa Milano, who's the American actress, and she'd been on social media and said, hey, look at all the hair I'm losing. Now, interestingly enough, she'd had a lot of different symptoms, but had tested negative for corona twice in March. And then she had an antibody test a little bit later, which was also negative. So confusing. And she wanted to warn people that this virus was serious and say, hey, I don't know if you knew about the hair loss. But then in August, she had another antibody test and it was positive. So, I mean, I think this whole thing's a bit of a warning. And I think this is how we sort of found out about, people with long hauler symptoms, that were suffering multiple symptoms over many months. And maybe this could be important down the line. But we don't know until people like Alyssa Milano come out and say, hey, has anybody else got this? And it's just sort of something else that, we don't know if it's significant. Hopefully it won't be, and hopefully it's down to stress. But yeah, just another example of how confusing this virus can be.
The Alps, timeless and changing.
Every year we have to add an additional 80 steps. It's losing like 6 meters of ice every year.
Spring is now 3 to 4 weeks earlier than it was 50 or 60 years ago.
The restaurant is shifted with the glacier beneath it. Climate change, helping to push a hut over the border from one country to another.
The Alps, timeless and changing. Online now at cgtn.com/Europe.
Well, Shini, every week in science is an exciting week, but was there something in particular that caught your eye?
Yeah. For me, I've always got a thing about throwing away food.
Me too.
Yeah, I'm like trying to save everything. But researchers at Flinders University, which is in Adelaide in South Australia, have come up with this new kind of sensor that is kept inside the packaging of seafood, and it can detect when it spoils.
Oh, that's handy for seafood because you can get very sick from that stuff.
We get sick because of something called biogenic amines, which play an important physiological function of all living cells. But any high levels of this stuff in seafood has a really adverse impact on human health, and that's what causes the food poisoning.
Oh.
So the way it works is that they've come up with a solid state fluorescent sensor, which is loaded onto filter papers. And it basically lights up when the seafood creates these biogenic amine vapors. And so the sensor would kind of light up when it's gone off.
Huh, so simple, so clever.
Yeah, it's like the way it's used is very simple. And so I think it's quite an exciting invention. It's been a long time coming, but it's the idea that we will throw less food away because, we're overfishing in some areas of the world and things like that. So if we can become more efficient in the way we consume seafood, I think that's only a good thing.
Definitely. It's such a precious commodity, but it'd be good if we didn't fish as much, but at least the stuff that we do fish and pull out, and it'd be good to know whether we're wasting, any of it, some of it, definitely. Love it. Well done, Aussie.
So Emma, what have you got for us this week?
Well, it's all very exciting at the moment, isn't it? We're starting to hear about the success of COVID vaccines and trials, but there's still other really interesting research going on into the virus. And at Cardiff University, a study has found that mouthwash, good old mouthwash, can eradicate coronavirus within 30 seconds of being exposed to it in a laboratory. Now, that's probably a very key word there, laboratory only so far. So it's a prelim result, and it comes ahead of a clinical trial into whether using over-the-counter mouthwash has the potential to reduce the levels of COVID-19 in a patient's saliva. And I guess you could sort of think of mouthwash as a bit like hand sanitizer, really, isn't it? For your hands, mouthwash for your mouth. Now, this report says that mouthwashes contain at least 0.07% of cetylpyridinium chloride, CPC, let's call it CPC, and it showed promising signs of being able to combat the virus. So the report is yet to be peer-reviewed, but it supports other recent studies that found that CPC-based mouthwashes are effective in reducing COVID-19's viral load. The results of the 12-week trial will be published in early 2021. I mean, obviously, a lab is very different from a person's mouth, and the study won't give any direct evidence of viral transmission between patients, but it will show scientists how long any effects last following a single swill of mouthwash. So isn't that lovely? Just another little simple way, hopefully, if the trials go well, that, we can get the hand sanitizer, we've got the masks, we've got the mouthwash, nice little potent combination.
All things that we already had. Brilliant.
Yeah, and gosh, how clean are we now after this pandemic? I mean, it goes to show how grubby we were before. But, now we're washing our hands and we're wearing masks. And, I mean, God, we might even start wearing, using mouthwash. We'll be fresher, better people. I'm all for people using more mouthwash, even if it doesn't, actually affect COVID. I mean, mouthwash is a good thing.
Yeah, I wonder, now I'm going to look on the back of my mouthwash and see whether it's full of CPCs.
Yeah, definitely. I mean, yes, let's not get excited. I guess we can sort of safely say to people, it's okay if you start using mouthwash. That's not going to do any damage. But we don't know if this is actually effective yet. But look, think of it this way. At least you're going to have fresh breath and your teeth will be happier. So there's no harm there. I mean, it's a process of elimination, isn't it? I mean, I don't know that mouthwash is going to be the answer to all our problems. But certainly I like having these little simple things that we can all do without having to go to scientists and doctors and, hospitals for help and vaccines and stuff. I mean, vaccines, we desperately do need the vaccine, but look, every little bit helps. I mean, look at the South Korean man. I was reading about him the other week. He invented a device that fits over the rails on escalators. So it just sort of clips onto the bottom of the rails and it's got a UV light in it to kill the bugs. So look, there's another one, because, I mean, how terrifying is it going to I'm thinking about germs a lot more these days. When you touch handrails, shopping trolleys, those buttons at the pedestrian crossings. I mean, I reel back in horror now whenever I see these things. But yeah, just a UV light on an escalator rail, clean as a whistle. Brilliant.
I think added to the list of mouthwash, hand sanitizers, masks, will have to be our own personal UVC light source.
Yeah, and if we can find some way of convincing people that, wearing deodorant actually stops COVID, then I think we're onto a winner. I mean,
this social distancing malarkey is really suiting you, isn't it?
I am becoming a clean freak. It's terrifying.
Stay away from Emma. That's it for another edition of Razor. Remember to subscribe wherever you get your podcasts.
Also, if you want to see the videos from some of these stories, go to CGTN Europe and type in Razor. Also, we have a brand new YouTube channel, very exciting. And all you need to do to find it there is type in Razor Science Show. Very official. Very official.
Thank you so much for listening. See you next time.